everybody. I'm Tina, and this is Dr. Scott Resnick, and we are so excited to be here today. We're going to spill all the tea about hormones and peri-menopause, and today we're going to be talking about what is functional medicine and how it can help you balance your hormones and get through peri-menopause. Dr. Scott, you want to tell us just a little bit about your background?
Oh, absolutely. So I'm a formally trained, received my postgraduate training in general surgery, and I was fellowship trained as an obstetrician gynecologist, which I practiced for probably a dozen years. And at a certain point, what I found is that I was starting to use more natural and alternative modalities as opposed to having to go to the operating room or use conventional medications. I did a fellowship in metabolic and anti-aging medication in about 2012 or 2013. And I've really been practicing sort of this natural and alternative approach to medicine since then. As you know, I'm coming to you from Canada, where I was brought up
Yeah.
here to work for a medical technology company, which actually taught computers how to think like functional medicine doctors. And I think that's really the future of medicine, truly personalized medicine, where we'll be able to engage with computers that can look at the information that we've shared with them and basically relate us to every other bit of information in its database and say, Scott, based on your genetics, your eye color, your height, your zip code, your dietary choices, your supplementation, your medicines, your best way to extend your lifespan, to live with more energy and focus, to feel better is to do this. More recently, I've been working on programs to actually empower people to be best stewards of their own healthcare. So I think we're seeing sort of a transition in medicine, right?
Yeah, that is really exciting. And I am not a doctor or a nurse, but I have been a patient of functional medicine for the last 2.5 years. And I can tell you that over the 21 years that I had been really ill, I really did not see much improvement. And I started seeing improvement immediately with functional medicine. So I'm excited for us to talk about this today and let the people, the women out there who are, in perimenopause, their hormones are unbalanced, they're tired, they're, frustrated, their anxiety's high, they don't know what's going on, they're just tired, they can't remember where their keys are, and they're going, what is happening to me? Because we just keep getting these questions. So can you tell us a little bit about, like, in layman's terms, what is functional medicine? What's the difference between that and regular medicine, general medicine as we know it?
Well, I'm gonna throw that question back at you,
All
Tina,
right.
because
Okay.
we engage, we do this as just like a conversation together.
Yep.
What would you say your interpretation is of regular medicine? Let's just start there, because
Okay.
it's easier to talk about how things have changed if we take a moment to assess, where things are currently. So, when you think of going to the doctor or using conventional medicine, what does that mean to you?
So I went to the doctor a lot for 21 years and I had fibromyalgia and chronic fatigue, and that's what I was treated for. We never really did much exploration into anything else. I didn't think I had anything else. And I was treated with medicine. So I went in, what's the new medicine? What can we do? I did do therapy, things like that. But mostly it was what I realized is if it's acute, they'll give you medicine and you'll get better. If
Mhm.
it's chronic, they'll give you medicine and you'll just need
And it
more
won't get
medicine
better.
and you don't get
Yeah,
better. Yeah, that would
right.
be they want to help you. Their intentions are good, but if it's not acute, you're probably in a little bit of trouble.
Right. And you just kind of teed me up there with a nice little segue. Because what's interesting is that as conventionally trained doctors, we are given a discrete language and
Mhm.
subset of information and set of tools to examine things with. And what's been unfortunate is over the, 140 years of, 120 years of mainstream medicine is that we have convinced ourselves that the only way to address these medical questions is with the language and the assessment and the tools that we were given. And I can tell you that I went to a allopathic medical school.
Mhm.
I did 6 years of postgraduate allopathic residency training afterwards, right? And
Yeah.
I'd been an allopathic practicing doctor for about a decade. And I said, you know what? I'm going to look up allopathy in the dictionary because I'd use the word all the time and I
Yeah.
didn't know what it meant. And so it turns out when you look up allopathy, it basically says the use of a drug or a potion or a treatment to counteract the symptom.
Okay.
So what we're taught in medical school all of the anatomy. We are taught what the symptoms are and a correct discrete range. So,
Mhm.
if your hemoglobin A1C starts going up, here's the biology behind, why these molecules are getting glycosylated when, from extra glucose in your bloodstream.
Mhm.
And if you get up to 5.7, you're a pre-diabetic.
Yeah.
Now, at that point, now that you've entered into the magical range, like
Yeah.
a blood pressure of 140 over 90 is the problem, but not 139 over 89.
Yeah.
It's
Right.
like
Right.
like so it doesn't click us into, oh, like we have to start doing something. So once you establish that certain diagnosis, then there's a sort of a spate of medication that you can
Right.
then choose from. So the conventional medical language is limited by one, establishing a diagnosis based on some objective findings,
Hmm.
and then two, matching that diagnosis with an appropriate drug. And then at that point, it's just give that person the drug, make sure that there aren't too many significant side effects, and what's to see if they get better. How do they get better? Oh, their numbers, their test, their finding then goes back into the prescribed normal range.
Yeah.
So this is the thought process of medicine. And what is interesting is that the first thing, as we begin to segue over into a new way of thinking, sort of beginning to think functionally, rests in one fundamental question. And that one fundamental question is, what are the factors that make up these biological changes or
Right.
constitute a diagnosis? So like I could go into a hypertensive specialist, right? And say, you know, why is this person hypertensive? Oh, it's because there's high resistance in their blood vessels and their blood vessel walls are thickening, and that means their heart needs to beat harder. Okay, that's all well and good. But what happened that made their blood
Right.
vessel walls start to thicken?
Right.
Why is there more resistance in the vascular tree? And then what are the side effects of this heart now having to do
Yeah.
more work to overcome this resistance? And that's when they would go,
Yeah.
we don't ask that
Right.
question.
Yeah.
So
Yeah.
So what I was going to say was that so the first foundation of doing functional medicine, because that's what we're talking about
Mhm.
right now, is I believe it's the ability to begin to ask some different questions.
Yeah.
And the most basic question is, what constitutes health and what constitutes disease? Isn't
Yeah.
that interesting?
Yeah.
It's like because we spend so much time saying, "Oh, I'm sick. I need to see my doctor. I've got a condition."
Hmm.
But at what point do you become healthy,
Right.
right? So what are or well, I'll ask you the question. What makes you feel like you're in a state of health?
I think for me, it is being able to, after many years of pain and, muscles aching and it's being able to move freely, right? It's
Hmm.
having energy. I was in burnout for quite a while. So that was really difficult, having literally no energy. I mean, almost no
Hmm.
energy, and nobody knowing why that was happening. And then figuring that
Hmm.
out 3 months into functional medicine, by the way, little side note.
Right.
But yeah, I think it's being able to just do your life. I didn't have a whole lot of life for
Hmm.
21 years. So for me, I look at functional medicine, it makes me functional, right? And I had no
Right.
idea
Right.
what the cause was of my illnesses, and no one else knew either. Well, we don't know. Fibromyalgia, we don't know. Well, chronic fatigue, I
Hmm.
don't know. And, lots of people have it and and then, you start getting these tests that check everything. I am definitely a
Right.
layman. Ladies, I am a definite layman. I do not understand, know the proper speak, but I've been through it and I know, you know, how it feels to be sick and then to not
Right.
be sick anymore.
And let me interject there just to say that I want to, going forth in our discussions,
Hmm.
to let's just dispel with this idea of you're a layman or you're an expert. Because what I found in my years of practice, and I've been doing functional medicine really exclusively for maybe the last 15 years,
Hmm.
is I've never ceased to be amazed at how well educated people are
Yeah.
and how capable individuals are with,
Yes.
maybe even like a high school education. If you can sit down for 30 minutes and you can watch a YouTube video, you can read something, you can become well enough educated.
Mhm.
Now, the secret to it all is really teaching oneself to see the forest for the trees,
Yeah.
so to speak. Because in functional medicine, it's really there are a lot of rabbit holes,
Right.
right? And there are a lot of rabbits. And what I find is that it's really easy with all of the internet tropes and memes and like the cultural, like everyone needs to drink a gallon of bone broth a day and
Right.
stuff like this, that it's easy to get lost in really understanding the different questions that we can ask about what makes the body work differently. So that's I think one of the foundational things of functional medicine is actually being able to take the stand to ask different questions,
Yeah.
which is really a state of allowing ourselves to be curious and to have a greater state of exploration, right?
Yeah.
And there's a great expression, which is you want to be interested and not interesting,
Yeah.
right? Doctors are interesting. Functional medicine providers are interested,
Yeah.
right?
That's really
They want.
interesting. That is interesting because that is really interesting to me because I never noticed, like when I was going to a general practitioner, which I have a great primary care doctor, but they look at everything very singularly.
Mhm.
Everything that's going on with your body, it's like, okay, well, that's that. That's this part. That's your, hormones. That's your, GERD. That's whatever the list is. But you go to a functional
Mhm.
medicine doctor and they look at everything as a whole. They look at your whole body.
Right.
And I never knew that, but there were so many layers to your health and to each diagnosis, right?
Right. And that's a good adage, which is that if you don't take a moment to look for something, you're
Yeah,
assuredly not going to find it.
right.
Right. I mean, and so much of health and wellness is not, yeah. I mean, like, remember the old, you and I are half an age, like, do you remember
Yeah.
the old Steve Martin gag, where he had like that little hat that went over his head and it looked like there was an arrow
Oh,
going
yeah.
through his head. It's like you go into the doctor, it's like, doctor, there's something wrong. It's like, okay, there's that arrow going right through your head.
Yeah.
You can't miss it.
Yeah.
But that's almost like a parody of a gag, because the truth of the matter is that sometimes medicine presents that way. When someone walks into your ER and they're sweating and clutching their chest and saying it's hard to breathe, you say this person's having a heart attack.
Hmm.
Okay, and now let's do all the things we can to improve the blood flow to the heart and increase oxygenation and all the steps that a doctor would
Hmm.
do to reverse that. But when somebody comes into the doctor and they say, doctor, I'm not feeling right, I don't have the energy, I'm having like tingling feelings in my fingers. I'm feeling more anxious. My chest is tighter. What what can I do? Because conventional medicine has not been trained to begin to ask more questions. Oh, what happened? When was the last time you felt good? What
Hmm.
happened differently in the last couple months? What changes have taken place? That instantly that forces us to go to a diagnosis.
Hmm.
So tingly hands, chest tightness, more anxiety, nervousness, more fatigue. What's the diagnosis? Well, it's something psychological, because that's,
Yes.
so here's what we can do. Let's start experimenting with the, antidepressant
Yeah.
medications. If you're God forbid, you're a woman who's complained of anything other than a 28-day cycle where you bleed for 5 days and everything's perfect, we're going to put you on some birth control pills.
Yeah.
If you're describing low energy, well, of course, that's the place for Ritalin, so
Yeah.
we'll just give you some, methyl, what is it, some speed,
Yeah.
some Ritalin or something like that, to jack you up. So what it does is that, in my opinion, is the biggest schism and the biggest gulf
Yeah.
between functional medicine and conventional medicine. And the other big schism, as you know, is the fact that when we start asking different questions about what is creating these state of beings, right? They're
Hmm.
not necessarily diagnoses, right?
Right.
Because tingly hands, cold toes, foggy thinking, no energy, there's not a diagnosis. There's not a laboratory test that you can measure. But what's interesting is that so many of these things lend themselves to perturbations or alterations in the way that our biochemistry works,
Hmm.
in our nutritional status, in the health of our gut, the balance of our sex hormones, right?
Yep.
The way that we're making neurotransmitters, and the presence or absence of toxins in our environment. So instantly you can see that mainstream medicine is like assign a diagnosis based on a set of criteria, pick a drug.
Right.
Functional medicine says, let's look across a spectrum of different considerations and factors that all to varying degrees impact on a human's physiology.
Hmm.
And based on the story that individual has told me, let's parse out which of these things are most likely to be contributing to the state of the problems.
Hmm.
And I actually think that right there is where this is what I'm personally trying to evolve, because part of the problem is that so many people are practicing functional medicine with so many varying degrees of experience and training,
Hmm.
that it's becoming harder and harder to say, how can we look at some of these questions with some specificity, right?
Hmm.
So like, I mean, I'm going to really simplify this, but a woman comes in saying, I'm gaining weight, I'm having, my breasts are tender every time during the month, my mood is changing, my memory changes, my periods are getting heavier. that's not a place to start looking for heavy metal testing
Right.
or looking for mycological overgrowth and things like this. I mean, so what we need to start doing is creating, in the same way that medicine, conventional medicine, is almost hamstrung by saying this is the way we do things. I do think that when it comes to natural and alternative medicine or functional medicine, that there are a set of systems that need to be addressed and stratified, whereby there's a greater possibility that a symptom is being caused by this or this than something else. And I think that's one of the things that's currently lacking. It's really easy for somebody to go into someone who claims to be a doctor, might even have a medical degree after their name, but doesn't have the experience to be able to understand that we just don't need to be doing heavy metal testing, organic acid testing, food sensitivity testing, hormone testing of all the different body solutions on everybody. So part of as we just got done saying, part of functional medicine is really training ourselves to ask some different questions. My personal bias is we need to be focused and directed and, relate these questions around a certain framework. Because as you and I have discussed in the past, and probably as we will get into in subsequent podcasts, is I think that there's a hierarchical, systematic, and almost algorithmic way that our body needs to be addressed to ensure that our biology runs well, because when our biology is running well, the various symptoms, the hypertension, the autoimmunity, all these other things start to get better. And then the final thing that really discriminates this from mainstream medicine is the fact that we can use herbs and we can use nutrients and we can use supplementation. And there is an evolving library of information that's out there that more and more begins to support this style of thinking. But changing the status quo, as you know, is a tough nut to
It is.
crack,
It
right?
is. And I love what you just said there about, there's a lot of options within functional medicine that you can use. And in
Mm-hmm.
general medicine, the thing that I found is, even though I was grateful for the medicine, it gave me relief, from a lot of my symptoms, but it also created a lot of symptoms, a lot of
Mm-hmm.
symptoms. And when I started in with the functional medicine, we spent 3 months kind of clearing my body out from a lot of the medications, which was really
Mm-hmm.
shocking to me over the years. And then the other thing that I noticed as I went forward with the supplementation, the herbs and things like that, there were no side effects.
Mm-hmm.
And that
Right.
was really a huge eye opener for me to go, wow, how many of my symptoms were actually side effects of the medicine that I'd been
Sure.
taking. So I found that I loved the alternative. I, was very, very happy with that. Could I go to the pharmacy and pick it up? Nope. And so that was
Right.
something you have to start planning around, but it was worth it. It was definitely worth
Right.
it.
And even that's something that you and I should probably talk about sometime,
Yeah,
because what the problem is that none of this stuff is regulated. And even
right.
if you go to the store and you go to a good supplement maker and you buy ashwagandha, an adaptogenic herb, are you buying the leaves, the roots,
Yeah,
the stem?
yeah,
Has this been standardized? Was it organically grown?
yeah. We'll
There's
do a
so many different
podcast on that for
questions.
sure.
Yeah, so there's a lot of there's a lot of variability around that as well. So
Yeah.
I think that's our challenge moving forward is maybe two-part. Is one is developing modalities like you and I are doing here to
Hmm.
help to empower people to be best stewards of their own healthcare. And as you and I have spoken in the past and will in the future, my belief is that through systematic approaches, by establishing a
Hmm.
foundation and almost like modules whereby we can learn, that I think that, and I don't say an average person, don't get me wrong, someone who doesn't have a medical degree, not
Right,
even a lay person, which is what you said earlier, can learn to educate him or herself to
right.
really understand what's going on in the body. And then what's really neat is that more and more there is access to some of this testing. We all have access to good, high quality
Hmm.
supplements, right?
Yeah.
And more we're going to become more able to address and follow and modify how we feel relative to just being in that go to the doctor, have somebody tell me what to do, this is the medicine you have to take, that doesn't give a lot of options, because I think it's important that we all have our own autonomy to
Yeah.
do what feels right to our body and to learn from it. Like I
Yeah.
said, one of the most important things is maintaining a sense of exploration and curiosity. And I think that's one of the fundamental things that's been lost in mainstream medicine.
Yeah. I love that. And I think this is a great place for us to end it today. You've gave us
Perfect.
a great explanation. I feel like it's going to help people. If you guys have questions please let us know. You'll have our links in the bio to ask the questions, how to get a hold of us and everything. Thanks, Dr. Scott. As always, I love talking with you. Thanks for sharing your knowledge with us, and we'll talk to you soon.
Okay, Tina, it was great. As always, it's great to meet with you. So I
Thank
look forward to
you.
doing this again. All right, we'll
Thank
see
you.
you.
Bye-bye. Bye, everybody.